Good morning or good afternoon, depending on when you're tuning in today. I'm so pleased to be here. My name is Melissa Karp. I'm a board-certified doctor of audiology, and today I'm going to be talking to you about auditory processing disorders in the classroom. This is a topic that's near and dear to my heart. I've been practicing for 22 years, and I actually started my private practice to focus on auditory processing disorders. You have the potential to make such a difference in children's lives. So I hope by the end of this presentation, you'll have a better understanding of how to identify what children need to be screened for APD, and then after you've screened them, who's a good referral source, and then how do you work with them in the classroom. So sit back, enjoy, and let's take a look at the agenda. Okay, so here's the agenda for today. Our first block will cover what APD is. The second block is focused on identifying students in your classroom that should be screened for APD and how to refer them properly if they refer on those screening measures. And the last block goes over classroom tips, tricks, and technology that we use for students with APD. There are a few 5-minute activities for you to complete that are scattered throughout the presentation. You can take notes and complete them at the end, or pause the recording and complete the activities as you go through. So what is APD? APD stands for Auditory Processing Disorder. You may also see it referred to as CAPD, or Central Auditory Processing Disorder. Both are the exact same thing. It's really not in the scope or the time constraints of today's presentation to discuss the different types of APD and how we diagnose APD, because this is really a high-level overview. In APD, the ears are working normally, but the brain isn't making sense of all the information it receives. It's been referred to as auditory dyslexia, but that doesn't quite capture all of it. I find it easiest to think of it as what the brain does with what it hears, and keeping in mind the understanding that it's actually a functional listening deficit. There's a spectrum of severity with APD. Some individuals can compensate, and that's because their APD is mild. Others have more difficulty in listening situations than someone with a documented hearing loss. APD is not a rare disorder. It impacts at least 3 to 5% of children, possibly more, and that makes it more common than actual hearing loss. I can guarantee that you will see students in your class with APD. They may be misidentified with attention deficit issues or learning disabilities, or APD can actually coexist with learning disabilities, dyslexia, or ADHD. So let's look at why this gets so complicated. There is a whole continuum to think of with auditory processing, and this is why multidisciplinary management is so important. So we're looking at what we hear. So that acoustic processing is detecting, analyzing, and synthesizing auditory information. But in addition to what we hear, we also look at what we know. We have to attach meaning and integrate with other information. So that's that phonological or linguistic processing. And as we process, there has to be a response. So what do we do? And that goes into organizing, executing a response, and maintaining focus, and that's more linguistic or cognitive processing. So our speech pathologists, occupational therapists, educators, and psychologists are also very, very important to management of the whole student. However, I do want you to take away from this that an audiologist is the only professional whose scope of practice includes diagnosing APD. APD can impact all of these areas. So different categories of APD are going to have specific types of deficits associated with them, and that's why it's so important to have a diagnosis. Screening tells you pass refer, but the diagnostic testing tells you what are the areas impacted and what are the specific interventions and accommodations that can actually help. Localization is being able to tell what direction sound is coming from. So that requires both of your ears to be working together properly. Listening in noise requires either binaural separation or binaural integration. That's an auditory processing skill. Decoding and spelling deal with an individual being able to hear the differences in the individual phonemes or speech sounds and create a sound symbol association. And if you see a student with really strange invented spelling, that's a huge red flag for decoding deficit. Patterns, rhythm, music, syntax, semantics, pragmatics, those skills fall under temporal processing. If you have a student with temporal processing deficit, they may have a monotone voice or not be able to tell the difference between an inside voice and an outside voice. They may have a hard time understanding sarcasm or jokes, and this impacts social communication as well as academics. Following directions may be impacted due to auditory working memory deficits and cognitive load. There are only so many resources available in the brain to process information at any one time. So, for example, if a student has a decoding auditory processing disorder, their cognitive resources may be reallocated from short-term memory to help with decoding. And you end up with a student who can't process more than 1 or 2 step directions because by the time they're able to decode what was said, they've missed part of the directions or they forgot the first part. This also looks like slower processing speed. It takes a bit more time to understand and possibly organize the information they're getting auditorily. And all of those factors influence their listening stamina. Think about a time when you've taken a phone call with a bad connection. It takes so much more effort to listen and understand what the speaker is saying if the connection has static or bits and pieces drop out. And if that phone call goes on for more than a few minutes, it gets frustrating. And eventually you start to tune out or you say, I'll call you back. Well, students with APD can't call you back, so they eventually tune out. So you can probably already picture how this impacts education. If you have a student that can't hear the differences in speech sounds accurately, they can't attend consistently to the signal of interest, especially in noise, they can't reliably hold the auditory information in their working memory long enough to manipulate that information, or they can't easily organize auditory information, how are they going to perform higher level tasks? And I see this all the time in my clinic. Students have been receiving tutoring for years and falling farther and farther behind because the tutor's working on these higher level skills without actually addressing the foundational skills. So it's like building a house and trying to work on the roof before the foundation is complete. It's inefficient and it ultimately doesn't work. Now that we've talked a bit about what APD looks like, I think it's important to know and remember what APD isn't. APD is unrelated to intelligence. You have highly intelligent people and they can have APD. The greatest factor in success for a child with auditory processing disorder is the attitude and understanding of their teachers and caretakers. You can truly make a difference as to how they feel about their performance. Individuals with APD often feel anxiety. They think that they're dumb. They notice others are able to get A's without as much work, and they can see the difference. So we truly want to identify, evaluate, and remediate this before anxiety becomes worse and impacts their self-esteem. So this is going to bring us to our first activity. Take 5 minutes and think about what we've just spoken about. What is your takeaway and understanding of APD? What might that look like in your classroom? Then I've included a link to a YouTube video simulation of APD. You're going to need headphones for this task, and it can be done anytime that's convenient for you. See you in a few minutes. Okay, welcome back. So now we're going to talk about identifying students for APD screening and the proper referral method. So who should be screened? These are some of the red flags that should make you pull out one of the screener tools that we're going to go over. The biggest red flag is any student you suspect of hearing loss who then passes a hearing screening with normal hearing. So I'd like you to make that switch of thinking, they hear what they want to hear, to they hear what they can hear, and investigate further. Articulation errors that are treatment resistant are included on this page because children speak the way they hear. If they're not hearing the sounds correctly, they aren't going to produce them correctly. And you may be wondering about why dyslexia is considered a risk factor here. It's estimated that at least 50% of children with dyslexia have an underlying disorder within the auditory system, and that's disrupted their normal acquisition of language. So I do want to mention in the handout section of the dashboard, I've included an article that shows how providing better access to speech sounds can actually improve the brain's understanding of sounds at the neural level in these students. If you have a student whose invented spelling is difficult to read and understand, that's a red flag for decoding deficits. And finally, students with Apd organization deficit have difficulty listening with any type of visual distraction. So these are the students that you might notice they close their eyes, or they put their head down on the desk while they're listening, or they might become more confused when you try to provide information in multiple modalities, like talking and showing slides at the same time. And if you're in the schools, you might already have the luxury of having some test scores available to look at. And if you do, you might see scatter across the psychoeducational tests with poor performance on those auditory dependent areas, or a discrepancy between receptive and expressive skills on those speech-language evaluations. I went ahead and broke it down a little further to look at what you might see in specific age groups. So Apd skills can be tested by an audiologist starting at about age 4 years. There are some limits to what can be tested at that age, and I typically don't diagnose Apd before age 7 just because there's a lack of age norm tests available. But it is a great window of opportunity to identify and start working on those areas of weakness early. If they aren't identified and managed early, I worry about Apd leading to speech and language delays and academic problems. And if you're working with some of those little ones, the 3 to 5 year olds, it may look like sound sensitivities. You'll hear some differences in their speech. And sometimes you might see some behaviors that look like behavior problems and adjustment difficulties or immaturity. Here are some more behaviors to be aware of in preschool and kindergarten age student. So these are students that they may learn better through hands-on activities, when you show them what to do rather than tell them what to do. They may have an easier time with some nonverbal concepts such as matching colors and shapes. They could have difficulty learning nursery rhymes. They may sing way off tune or have a monotone voice. Poor phonological awareness skills, so those are things like sound discrimination, sound symbol relationship, or identifying the beginning, middle, ending of words. These may be students that avoid noisy situations and group play activities. Or they may like music but have difficulty learning the words. So a student that can sing the words but not the melody, or sing the melody but not the words, then that's a good referral for Apd evaluation. Moving on to these elementary school or lower school students, 3rd grade seems to be the year when a lot of children are first referred for diagnostic Apd testing. And it seems to coincide with that switch from learning to read to reading to learn. And those early compensation skills that might have been getting them through aren't going to be enough. I also want to stress that it's not just students who are falling behind that may have Apd. Again, Apd doesn't reflect intelligence or ability. Gifted students with Apd may be able to perform on grade level, but they're still not performing up to their potential. Keep these behavior characteristics in mind for those elementary and lower school students. They may frequently ask what or huh. They may not understand announcements over the loudspeaker. These are the students that might have difficulty following the discussion or will make off-topic contributions because they misheard. They can seem easily distracted or bored when you don't use visuals. There can be difficulty with complex language such as word problems. So if you give them a computation problem, they do well. But as soon as you start putting in word problems, that's when they have a difficult time. They may have poor word finding when they're speaking, or they might really have that slower couple seconds or a delayed response when you give them instructions verbally or you ask a question. In an ideal world, we catch APD before the students are falling behind or experiencing failure, so we can work on strengthening those skills at a younger age to take advantage of the neuroplasticity. Middle and upper school demands are much higher than lower school, and those demands are educational and social. This is a critical time for self-esteem issues, anxiety, and depression to surface. When a student has undiagnosed APD, all they know is that they're working hard but not seeing the results they want. And it's easy to internalize that as being stupid or slow, even though that's absolutely not the case. You may see a huge decrease in motivation, that whole, well, why bother if I'm not going to do well? And you might even see some behavioral problems start surfacing. Some red flags you might see in these older students are difficulty in foreign language classes that requiring a listening component, not having enough time to complete standardized testing, poor performance in classes where the instructor speaks quickly or has a strong accent, and difficulty with assignments that have multiple parts. One tip that isn't on this slide: take a look at the students' notes of their auditory lectures. Are they neat, organized, complete, or are they messy with a lot of unfinished thoughts? What does the spelling look like? Could you make sense of the notes if you were unfamiliar with the topic? You can tell a lot about how the brain is working by looking at notes. So now that you've identified a potential student to screen, what tools are available for you? So all of these tools are available for download from the dashboard with the exception of the Feather Squadron app. Fisher's Auditory Problems Checklist is a super easy questionnaire to fill out and score. It has norms from ages 5 to 12 years, and there are 25 questions to review, and you just check off if the item's of concern. Scoring information is on the checklist. The cutoff score for referral is 72%. Now, the Sifter is available in 2 versions depending on the age of the student. And this checklist has 15 questions spread out over 5 categories. And those categories are academics, attention, communication, class participation, and school behavior. And scoring information is also on that form. If you have an iPad, you can download an app called Feather Squadron to screen with auditory tasks. So you will need headphones, and you would just select the free screening option. And the screening walks the individual through the tasks and provides results at the time of the screening. And you might even want to screen yourself. So these are just a few items from the Fisher's Auditory Problems Checklist. And again, you have the complete checklist in the download section of your dashboard. There are 25 questions to go through. You check each item that's a concern, but the checklist is scored by counting the number of items you didn't check and multiplying by 4. And again, that's all on the checklist. You don't have to remember that. There's normative data for ages 5 through 12 years. And again, the cutoff score suggesting you need further evaluation is 72%. There is a lot packed into those 25 questions. It looks at attention, auditory visual integration, comprehension, auditory closure, speech and noise, localization, long-term memory, motivation, performance, sequential memory, and even speech-language problems. You also have the Sifter Questionnaires on your dashboard. The Sifter was designed to screen for educational risk in students with hearing loss, but it is an excellent tool for looking at performance of a student with suspected APD. Because remember, APD is an auditory issue and it's on that spectrum of hearing loss, even though the student hears the beeps when hearing is tested. These questions ask you to assign a score on a scale of 1 to 5 for each item. So if the question is, how often does the student hesitate or become confused when responding to oral directions, such as turn to page, whatever? Your scale of 1 to 5 might read 1 would be frequently, 2 to 4 would be a range for occasionally, and 5 would be never. The norms are listed on the screening tool so you can easily see where the student falls. Feather Squadron is a screening tool that's available on the iPad only. You would just go to the App Store, download the Feather Squadron app, and then there's an option to select parent screening. You do have to use headphones for this. There's an area where you add in the student name and age, and that provides you those normative scoring. And this is appropriate for ages 5 years to adult. So if you have a student that refers, who do you refer to? This is a big soapbox of mine, so bear with me. There are speech pathologists and psychologists who claim they can evaluate APD, or that students don't need a diagnosis to treat APD. This is such a disservice, and it's truly unethical. Diagnosing APD is not within the scope of the practice of any profession other than audiology. The testing has to take place in a sound-treated booth with carefully controlled output to one or both ears, and any testing not conducted in that manner is not assessing APD. So a proper diagnosis is essential to proper treatment. So what helps a student with decoding disorder can be a disaster for a student with organizational deficit. So please, please, please find an audiologist who works with APD in your area and build a relationship. That being said, speech pathologists and psychologists are incredibly valuable members of the APD team. Students with APD are not just their ears and a brain, so we need to treat the whole child, and for that we need the specialized skills of speech pathologists, psychologists, educators, and in some cases occupational therapists or tutors. The point is that audiologists are the only professional who can evaluate and diagnose APD, period. So how do you find an audiologist with this skill set? I've got 2 websites on this screen. APD Support, that first URL, has audiologists in just about every state, including North Carolina, and even other countries that specialize in and have completed specialized training to evaluate APD and or treat APD. The second URL is the North Carolina Audiology Association, and that's a directory of North Carolina audiologists, and you can even select what specialty area you're looking for. So there's an option for auditory processing. You would click that box and search, and you'll see the audiologists in North Carolina that work with APD. So for your next activity, please download and complete one of the APD screening tools that you have on your dashboard. You can make up a student or even complete it for a student you may have that concerns you, or a student that may have concerned you in the past. I'll see you in 5 minutes. Welcome back. I hope the screening tools were easy to understand and you were able to complete and score one. If you have any questions, my contact information will be on the last slide of this presentation, and I am happy to walk you through any of the screeners. So let's move our attention to what classrooms are looking like these days. 2020 has been a year of many changes and challenges, and I can't even tell you how many times I've heard the words "the new normal" or "we're going to have to pivot" used when discussing how we do our jobs. So think about what your classroom looks like now. Think about how this is impacting auditory information. Masks muffle speech. Even individuals with normal hearing and normal auditory processing are having difficulty understanding speech when the speaker is wearing a mask. Some schools have erected plexiglass shields between students, and this is absolutely devastating to speech perception. You may be teaching to a class where students are spread out to social distance, so your voice has to carry through a mask even further. Or you may be teaching virtually through an online platform and the students aren't physically present. There are all sorts of masks available now, and a really nice study took a look at how they impact understanding in the classroom. So the first takeaway from this slide and this information is that remote microphones are an important tool to make up for the decrease in clarity that masks can create. So a remote microphone is a mic that the teacher wears around their neck, and it transmits sound to speakers in the classroom, or in some cases directly to a student's ear-level devices. The absolute best listening situation was when the instructor used a face shield plus a remote microphone. However, the CDC actually walked back that recommendation that said face shields were enough, so we're going to take that option off the table. The next best situation would be a cloth or a surgical mask plus a remote microphone. The window masks or clear masks don't live up to the hype for improving speech cues. They're great for providing visual cues for individuals who lip read, but that clear plastic muddies the sound of speech more. So I would tell you keep this chart in mind when choosing what mask you use. So with remote mic and speakers, that combination can be called FM. We have known for over 20 years that every single classroom should be equipped with FM systems. Research came out in 2000 that showed measurable benefit to all students in classrooms with FM, yet almost no students have the option. Soundfield FM doesn't stigmatize children, which, they can be stigmatized if they have to wear an ear-level device. And really, the teachers had great acceptance of soundfield amplification once they received in-service training and actually spent some time using it. Teachers even reported less stress and vocal strain during those teaching activities using the Soundfield FM. So one of the things that I hear is, it's too expensive. Soundfield systems are the most inexpensive technology for improving speech perception in the classroom. So, for example, if the average cost of a Soundfield system was $1,000 and you divide that by 25 students per class and note all the children in that classroom benefit, it would be about $40 per child. Then you prorate that over a 10-year period, which is about the average lifespan of these Soundfield systems. The annual cost per child is $4. I mean, $4 for so much better, more efficient, effective listening, you really can't afford not to. I would encourage you to think about FM in the classroom, talk to your administrators, talk to your PTA, and see if that's something that you can get. Regardless of whether or not you have a microphone, how you speak is just as important as what you say. Clear speech is how you speak when it's very noisy. It's louder, slower, and more distinct. It increases understanding by 20%. Pay attention to the rate of your speech when you're introducing new information. You want to speak more like Mr. Rogers and less like the voiceover in drug commercials when they list 50 side effects in 8 seconds. When you're giving instructions, try to use clear speech and pause after each instruction. That pause lets the information sink in before it's erased by the next instruction. And super helpful for students with deficits in auditory working memory, add a visual cue. Hold up one finger for the first instruction, 2 fingers for the second instruction, and that's going to help separate the information. It's a natural instinct to rephrase when a student says what or huh. So with auditory processing, most of the time, asking what is more about filling in a blank that was missed. If you rephrase, you're giving the student a completely new sentence with new blanks to fill in. So try repeating verbatim first. And as much as possible, get the student's attention before speaking. It can be as simple as, okay, listen up, here are the directions, before you start. If you're in a situation where you're presenting virtually, here are some ways to work with that technology. Rule number 1, mute everyone but the speaker. So if you're not talking, that mic should be muted. It's also important to make sure that lighting is good in your room. If possible, sit facing a window that's going to allow your natural light to stream in and highlight your face, and that's going to give the listeners and watchers more audiovisual redundancy. If your room has high ceilings or reverberant acoustics, invest in an external mic to wear. And if at all possible, record the class and allow students access to that recording, because that's really helpful for pausing to take notes or listening again when a word is missed. There are captioning options in many online platforms. check them out and turn on your captions if possible. Or talk with students about using a caption app, such as Otter AI, next to the computer when learning if they do need those captions. In addition to Otter AI, there are other apps that help with speech to text, and that's going to be beneficial for most types of APD, and especially helpful for students with integration, motor planning difficulties, and auditory memory deficits. There are also text-to-speech assist. That's going to help your students with decoding, organization, and auditory memory struggles. Electronic planners are actually beneficial for most students, not just those with APD. And when you look at recommendations in a report from your audiologist, they might have some really specific ways on how to use those planners. For some students with APD, even if their hearing is normal, the audiologist may have fit hearing aids. There is actually a lot of research behind this, and the hearing aids are used in a very specific manner for specific types of APD to give a bit of volume to speech sounds that are more difficult to hear, while using noise reduction technology for ease of listening. Not every individual with APD is an appropriate candidate for hearing aids. There are also software training programs that work to train deficits noted on APD testing. So this might be something that a student works on at home, or I've even seen some schools use these programs like Fast Forward as part of their literacy program. I mentioned a minute ago that not every student with APD will benefit from hearing aids. Well, not every student with APD is going to benefit from every single accommodation. We have to look at the student as an individual. This is where knowing exactly what type of APD and areas of weakness a student has is so important. So there are all sorts of checklists for APD accommodations on the internet, and I would advise you to steer clear of those. What helps one type of deficit might be the opposite of what another deficit requires. This is where the audiologist report and recommendations come into play. And of course, the goal of most accommodations is change from the most support to the least support to independent functioning. For your last activity, take a few moments and think about your classroom. What are 3 things that you can identify and potentially change to create a more effective listening environment? I find this activity very empowering because educators can make small changes that create big differences. My last slide is my contact information, and please use me as a resource. I am happy to send you articles, discuss acoustics in your classroom, answer questions about the screening tools and APD diagnosis, come to your school for in-service or continuing education training, or even help you find an audiologist near you to help with some of these identification issues. Thank you again for your attention and wanting to learn more about this. You are truly going to make a difference to the students in your classroom.